I'm pretty excited to share it with you. Did a bunch of homework for you, and we'll get it going here in a second. So I hope everybody's doing great. I know sometimes on Facebook and also YouTube, it can be a little challenging to get people's comments. So just if you'll bear with me on that, I'll make sure that everything is working for you. But thanks for joining. It's always great to have you. All right, we are good on. Facebook. Let me just make sure that. All right, we're in business. So, all right, let's get on it here. So we've been talking about the last few weeks. We've gone all the way from facet injections, epidurals, medial nerve branch blocks, microdiscectomies, and now we're talking about the big world of fusions. And fusions is a big world. And so I didn't want to go into every single subject about fusion because, you know, obviously it's not probably what you want. But I want to at least give you a recap on, I think, the important stuff that you need to know, because there's some really, really important things that you need to know to feel informed. When is it the right option? When is it not the right option to do? And do you have other natural choices to consider? So when we look at this, that's our topic today, unlocking the truth, understanding the pros and cons and your other non-invasive alternative choices. So let's talk about spinal fusion here. Oh, sorry, my little picture's above that, but I'll fill in the blanks for you. So what is a spinal fusion? So here, I can fix that right now. So spinal fusion, also known as a spondylolisthesis, is a procedure performed by an orthopedic surgeon or a neurosurgeon to fuse two or more spinal bones together. So as you can kind of see in the picture there and to the left of it, in some form or fashion, either a bony fusion or using hardware, that is going to be how they're going to do it. And the purpose of it is to prevent movement in the bones that are fused together. That's pretty much what it comes down to, okay? So let's go to here. And when's it necessary to do a spinal fusion? Well, there are some times that it's necessary. So I'm going to be the first person to wave that flag and say, yes, there are times. So let's look at it. Severe scoliosis. That's important to know. I've helped manage a lot of scoliosis with people over 24 years of practice. And, you know, I'll tell you, there's a lot that you can do conservatively if you're really well trained and you know what you're doing. So keep that in mind. You don't want to just go to anybody for that. But I've seen amazing changes where people didn't have to get rods in their spine. But there are some cases where it's so severe and so grossly that it's actually compressing on organs and causing changes in their body's function. Those are usually the ones that we need to do it on. Severe fracture, and I'm not talking about just grade 1 or grade 2 anterolithesises or retrolithesises. And what I mean when I say that term is that if you look at the spinal column here, when the bones are supposed to be lined up properly, if a bone slides forward like this, that's called an anterolithesis. If it goes backwards, I'm just trying to get you so you can see this really well. If it slides backwards like this, that's called a retrolithesis, retro meaning going backwards. A grade is 1 centimeter. So if it goes forward 1 centimeter or back 1 centimeter, that's going to be a grade 1. If it goes within 2 centimeters, grade 2. You can go all the way up to grade 4. I have managed a patient of mine for over 20 years. She's got a grade 5, and she's had 3 children and never had spinal fusion done. So you want to be conservative with this stuff. You know, you can always get it done, but there's still a tremendous amount of hope before that. So keep that in mind for that. Severe instability, usually due to a trauma, unfortunately, or diseases in the body. So, but it should be reserved when other more conservative options have been exhausted. And that is my beef with the spine surgeons these days. They're not exhausting conservative options. They're doing more and more surgeries. And you'll see why in a couple minutes here. So let's talk about this. So this is called axial stress. And what I want you to see is that, and there's all kind of different kind of fusion, so I didn't want to do a bunch of pictures in here, but I wanted you to be able to see that you can see the areas where the rods are, okay? And basically they're bolting together those bones. What winds up happening in the human body is that what it does is it dissipates. Hey, Stephanie Trinkle, nice to have you here. Aw, one of my homies from where I grew up. Thank you. So now you get to see what I did after high school. So these areas are fused, and what that does to the human spine is it takes the stress of the weight bearing of our bodies and it shifts it to this red arrow and down to there as well, to this bone. So the bone above and the bone below, the area of fusion, are going to take more load stress because these other guys are all bolted and they can't do it anymore. And that causes some issues, unfortunately, because what you'll typically see after a year to 3 years is people will come into the office, they'll start complaining and having pain again in the areas where the arrows are, where they're not fused, they're the ones above and below. So I try to bring some pictures together. I searched for a while trying to get some pictures to explain this. So here's kind of an idea. So take that log as your body weight and take each one of those people right there. They're all helping support it as the bones of your spinal column. Well, when we take some of these out of the equation for the most part and how they normally do their job, what happens is now this guy's got to work harder and that guy back there's got to work harder, and they start looking like that. And that's what takes place to the bones because they're carrying more load. And so people are going to come in usually complaining of that. The problem is that after they've gotten fusion, it limits some of the techniques that we can do and some of the tools we can do because you can't pull on hardware. So that's why I always say, decompression is the way to go in most of these cases, and do it with someone who knows what they're doing, or you can do it from home with Disc University that I created. If that's a better option for you, cost effectively wise and time wise, and you can have the success, which we'll talk about here in a couple slides. But anyway, you want to try that stuff before you can go get fused. But unfortunately, your surgeons usually aren't going to tell you that. And you're going to see why here in a second. So one of the other things that happens is you can get post-fusion neurological scar tissue. And what I mean by that is what you're seeing is all of this spider webby stuff right there. And the problem with that spider web stuff is usually people are going to be pretty good for about a year. And then what happens is after surgery, there's scar tissue. The body makes scar tissue. And what it does is it's like a spider web and a spider putting down more web and more web. And it starts to adhere to the nerve branches. And those branches can't slide like they're supposed to. And they start causing a lot of pain and a lot of neurological issues. And that's one of the biggies that I see with people. And when I meet them in restaurants, people ask me, what I do is I said, hey, like I had some pain relief for a while if I had a fusion, but then I started getting this nerve pain back, and that's a big reason why. The downside is that once you get that, man, most surgeons don't want to touch you. And what's that mean? That means you're on your own most of the time. And that's really sad because you wind up suffering with something. So that's why I'm so adamant in trying to inspire you to do things that are non-surgical first so that you don't have to worry and deal with that stuff, okay? So let's look at this next slide. Unfortunately, if you do get a fusion, you're gonna have a scar on your back. So here's a few of them. I would assume the girl in the middle right here probably wound up had scoliosis. So usually it's going to run all the way up your spinal column. These are going to be more like what we were looking at, where they're going to be doing lumbar fusions on people, but that's kind of what you get to live with, and you got hardware inside. So it's not the prettiest thing, obviously. So let's talk about costs of spinal fusions. We talked about the cost of every other procedure in here, and make sure that I have, yep. So here's the cost of the most common surgeries for men and women, and this was actually done by LendingTree. So these are guys that are actually lending money for surgeries and medical conditions. So let's look. Number one, coronary bypass comes in at $151,786. Spinal fusion, number two, $138,460. And there's some reasoning behind that, but I want you to know those are pretty accurate numbers, and they're only getting bigger, which you're going to see here in a second. So, you know, I have some really good friends who are pain management specialists and spine surgeons. They've been very kind to me. They have beautiful offices. And, you know, I'm watching the people that are going into these clinics that are in my neighborhood, and I'm like, man, these people don't look like they live in this neighborhood. And I'd ask them, I was like, where are you guys getting most of your patients at? And most of them were from personal injury cases where you're usually in an auto collision or a workers' comp case. And let me tell you, if you go those, you're typically going to be getting pushed to get surgery. So you got to be super, super careful with that stuff, and exhaust all your options. And that's why I do these lives, so that I can create content for you so you can feel more informed, so you can make better decisions about your health and not just be bamboozled by some doctor that's getting a big paycheck. So you can see right here. So average settlement for spinal fusion cases typically range between $150,000 and $600,000, and sometimes settlements going up as high as $12 million. So what's this mean? This means that the attorney's making a bunch of money. They're going to try to make some money for their client. The doctors that are doing this, when they go in, do I do a little small surgery or I do a big one? I'll tell you, the guys that are unethical, and they're going to be doing big surgeries on you because those are huge paychecks for them. Huge paychecks for them in their clinic. So you have to be aware, because you're the one that's got to live with this hardware inside. And they're not going to, you know, a successful surgery for most surgeons is that you woke up. You know, there's a joke, you know, what's the difference between a major and minor surgery? You know, minor ones only happen to other people. So you got to know these numbers, because, man, I'm telling you, I'm on Facebook groups, and I just keep, everybody is talking about fusion, discectomy, fusions, and nobody's talking about what we're going to go talk about. So you need to hear it from somewhere. So here's the future. And here's the problem is that if you look at this slide, and I'll take my mugshot off of here so you can see a little bit clearer here, is that this is the trend in mean age of spinal fusions. And look at this last part, and refusion patients. So you're going to see a lot of people that get fusions are going to get refused again because of all the stress that we talked about when some of the guys stop holding the tree and they walk away, and now the guys in the front and the back have to hold it up, and that's what you see. But most people that get fused don't want to get fused again because they know what it was like. So, but you got to look at, these are the numbers right here. They're real numbers, and you can see, you know, over time, it's like it getting bigger. And you want to talk about money, you know, I didn't even realize this, but so here's a graph. So let's look at 2022. This is the global, for our globe, spinal fusion device market. I kept coming across things about how much value is in a patient when they do spinal surgery and fusions on them. It's kind of sick to think about that people are just looking at it from a price perspective. But in 2022, $6.9 billion. And I put this slide in here because in the last 2 to 3 years, I feel like I have seen more fusion surgeries and artificial discs than I've ever seen before in 24 years of full-time practice. And I just like scratch my head. I'm like, is this just me? I was just like, maybe. And then I come across these charts and I'm like, this is not me. This is real stuff. So look at 2022, 6.9 billion. By 2032, 10.8. Let's just call it 11. That's almost a 50% improvement or increase in fusions of the spinal column. And my friends on Facebook wondering why that's all they're getting offered. Well, they're getting offered because that's where all the money's at. Makes me mad. And should make you mad too. So, do you have other options? Well, you do have other options, but you're not going to probably be told from your surgeon because they don't make any money on this. And yet it's probably the most effective treatment for bulging disc and herniated disc, facet arthritis and arthropathy, and spinal stenosis, which is usually, and degenerative disc disease, which are usually the top 5 that most people are getting fused on anyway. So why wouldn't you try this? But here's the thing. If you're gonna either go to an office and do spinal decompression, or you're going to do it at home, you're going to want to go to someone who is nationally certified in spinal decompression, usually more than one time. I have 6 national certifications in spinal decompression. That's all I've done for the last 10 years of my practice. So well knowledged with this, and I do that to share with you, and so you can have miracles in your life, because you can have miracles in your life, but you got to know which direction to go, and so that's why I share this with you. So I'm gonna, you want to go to guys that actually know what the hell they're doing. So in 2019, 20, and 21. I was voted one of the best spinal decompression doctors in the entire United States. And I only show you this because I want you to know that there are people like me that take this stuff super seriously. And the best part is that they get amazing results for people at 88 to 91% of the time. It's 3 times higher than surgery. And you don't have to get cut open and worry about infection. And you actually get your disc to be healthier and your spine healthier. So it's pretty incredible. So let's look at a pre and post, and then we'll wrap things up. So what you're looking at right here is this is actually a patient of mine. I've scribbled out all their names and any information for them. But if you look on the left right here, we are looking at pre-decompression. So this gentleman came in, he had severe sciatic pain. That's pain that goes down the buttock and leg into the foot, had severe muscle weakness, had diminished lumbar reflexes, and severe low back pain. Was told that he needed surgery from surgeons, and I want you to see, this is his extruded disc right here. This big black blob pushing on his spinal cord. And then when you look at this view right here, this is called the axial view. What I want you to show you is this right here, this white area that I just colored in, that's one of the nerve branches. So, we'll get you back here for a second. That's this. So you can see the spinal cord. Well, his was compressed. That's the spinal cord right there. Okay. And then you got a nerve branch that goes off to the right. And then this one you can't even see because he's got this big massive disc extrusion. So he's got this big blob of material that's pushing on his nerve like that. Of course they want to go and do surgery because they're going to have $100,000 surgery, especially if they're in there and they decide to fuse them. So that's what he had going on. I mean, that's some serious stuff going on. He was scared. This picture over here, the post-decompression, this is 12 weeks after doing spinal decompression on his spine and doing a couple other things, but all stuff that's very conservative and manageable. You just got to put him in the right place in the right time here. No sciatic pain anymore. No pain going down his buttock leg. Normal reflexes. Normal muscle strength again, where he had weakness, which is usually always a neurological sign. And minimal low back pain at this point. And I want you to look at the difference. So remember, this big red blob right there coming out, that material right there, you can't even see his nerve branch coming off to the left. It's opposite, just so you know, so you can see the little left and right marker here. That's his disc. At 12 weeks, sucked back in, off the spinal cord, off the nerves. And here you can see, same thing. All sucked back in. You can see his entire spinal cord right now. You can see his nerve branch coming off to both sides. You can't even do that stuff typically with surgery, and that's being done non-surgical. Does it take some time? Yeah, discs are the slowest tissue in the human body to heal. We know that. If you've been with me, you know that. They're avascular relatively after age 20. It's not a blood vessel to them anymore, so they're reliant on getting their blood supply from the blood vessels, the small ones, inside the vertebral body here, and they go through the end plate and through things called marrow channels. But it's not these big fire hoses of blood supply. They kind of very small, tiny ones, so it takes time. That's why usually decompression takes 12 weeks to get the disc to heal well. But that could be you. And that's why I created a course called Disc University. You can do this from your home. Doesn't matter if you have doctors that are certified in your neighborhood, in your town or not. I send you the piece of equipment, and I send you all the online courses. And basically, I took everything that I've learned over 25 years and I condensed it. And I said, what do I do in 12 weeks that just always consistently works for people? And we made videos on that. And I just take you one video after the next, and you just take baby steps, and you just do the therapy like I tell you to do. When we start introducing core strengthening and flexibility and nutrition and hydration, we teach you all that stuff to help you get your disc healthy. And believe it or not, it's that people get out of pain. It's amazing. So, you know, I love this. I want to be an advocate for people and let them know that there are other options of managing severe conditions like this. And you can do it from the comfort of your home, or you can go to an office. But you want to go to people that actually know what they're really doing. So, wow, I love and appreciate you as always. Thanks so much for being part of my family. Remember, my mission is to help millions live again, have a quality of life, and get back to a quality of life that they've lost because of back pain, and they can get it back, or they can play with their children again, or their grandchildren, or go on a vacation with their significant other, or just go out in the garden and do whatever they enjoy doing. You know, I got a guy right now, he's an old pilot, man, had severe herniated discs, and you know, now he's messing around in his RV again, like doing the stuff that he loves doing. That's what life's about, and that's why I do this. So I hope you've enjoyed this live. Please let me know if you did. Send me a message. Also, we're going to be doing a new series. This is the last one of this series of invasive procedures. So I'm looking for ideas and would love to answer questions for people. So if you have any ideas about what you'd like to learn about when it comes to spinal health, let me know. If I haven't covered it yet, would love to do it. So leave me a message, DM me, and I will definitely consider it. So hope you have an amazing day. I love and appreciate you being part of my family. I'll see you next week on Facebook and YouTube at 1 and Instagram at 12:30 on Wednesdays. Bye, Stephanie. Great having you here.